Okay, so today we are going to be talking about the veterinary laws and ethics, which, we're not going to school to be lawyers, so it sounds about as fun as it's going to be, but I'll try to make it as interesting as possible for y'all. And then we're also going to talk about success in the vet field. So bear with me, we've got a lot to talk about. So our objectives today are going to be discussed ethical and legal responsibilities associated with the veterinary practice. We are going to define what's called the VCPR, which is the veterinary client-patient relationship, and its role in veterinary practices. And then we're going to identify organizations that govern veterinary medicine, the most important ones for you guys here in Arizona, and then discussing the legal implications associated with the confidentiality of client and patient information. So, do we have HIPAA in the veterinary field? And the answer ultimately is kind of, but not really. So we're going to go through medical records and confidentiality and hit on some main points that you need to know for medical records. Legality is that VCPR, so you'll hear that term a lot. And again, sometimes we do talk in those abbreviations. So we might say VCPR in the field when we're actually meaning veterinary client-patient relationship. It's just a mouthful. And then different record logs, we'll just kind of touch on that, and then the governing bodies, and then we'll head into success in the vet field. So the primary function of medical records are to record services that are rendered and establish a contract between the practice and the client. So remember, we're not really establishing that practice and patient relationship because it's not just the practice and the patient, right? Every animal has to come with an owner. It's just inevitable that every animal be owned. Okay. The secondary function is going to be support evaluations of medical information for business, legal, and research purposes. So, we want to invoice our services and we want to make sure those services are invoiced accurately, for example. So medical records are ultimately legal documents. So that's why, in practicing that kind of philosophy of this is a legal document for quizzes, especially, in class, we have you guys use pens because we're getting you guys in the habit of, I need to use a pen and I need to write legibly and my spelling needs to be accurate. And because all of these documents that we write and that we put into our patient's charts can be actually sent to a governing body, can be sent to the boards to, evaluate whether a doctor did their job or not. Or a CVT did their job. CVTs, RVTs, LVTs, they can all be taken to the board. And so if these medical records aren't handled properly or aren't, done correctly, then it can incriminate a doctor. So it can, indicate that they might be doing any kind of malpractice. And so it might put them in some legal mumble jumble. So what we want to do as vet techs and vet assistants is make sure that we are handling our medical records as properly as possible. And, for example, with mistakes, we're not going to scribble it out. A scribble on a medical record looks very suspicious. So that's why we do the single strike through and we verify that we were the person that put that strike through, acknowledging that that information was incorrect. Okay. So everything has to be documented. If it's not written down, it didn't happen. That's what we say in practically every single class, every single sequence, all the time. If it's not written down, it didn't happen. So, that's why, especially when you guys are taking quizzes, I like when you guys at least put down your train of thought or a guess or something like that, because if you didn't write anything down, it's almost like you just kind of skipped over that question. You didn't have anything to think about it. So I would prefer that you guys write down anything and everything that you can think of when it comes to quizzes. But for medical documents, if you do anything to a patient, it has to be documented. That might even be just initialing that you took vitals or something as small as that. So it's either going to be typed or in black or dark blue ink, ideally black ink. They have to be initialed and dated. So it has to acknowledge that, yes, I did this on this day. No spelling errors. So on the computer, that might be a little bit easier. But if you're writing anything, so even if you're, your owner's signing an estimate and you add on that they want to add on something like a gastropexy to a spay, you have to make sure that you're spelling that correctly, because otherwise that can be, again, it can lead your doctor to get in some legal trouble potentially. So, in terms of abbreviations, we only want to use what's approved in standard. So one of my doctors came up with an abbreviation for itch factor. It was basically, his way of assessing how itchy a patient was. IF is not a standard abbreviation, so that's not something that we're going to be able to use. So we should type that out because IF is not universal. Even other doctors in the clinic don't really know what that means. So we want to make sure that we're putting universal abbreviations. So any doctor that picks up that record knows what we're talking about. Errors have to be corrected with that single strike through, dating, initialing it, and then putting in or the correct answer next to it. Okay, so if we were to correct this statement, the sky is green, right? We don't need to cross out the whole thing and rewrite the whole sentence. We just need to cross out green, put our initials in the date, and write blue. Okay, pretty easy. Veterinary clinics do have the freedom to structure their own records. So you guys will see as you move on from one clinic to another, or even from your extern site to wherever you end up working, that some places will use different online, software systems, Cornerstone, Avamark, Intravet, Woofware, or just to name a few. We have Navitor now that we'll be implementing. So as part of your guys' curriculum, you guys will have to implement by putting patients on the schedule, by documenting in their record, things of that sort. So we'll be implementing that in nursing class where we're actually going to be using those animals. So you guys will have to enter them into the software system. So each clinic will vary in terms of, again, method of filing and keeping records, but we have to at least adhere to the required minimum, the legal minimum. Now, what I'll tell you is there's a legal required minimum amount of time that a clinic has to carry, carry each record. Now with online documents, I'll tell you that clinics typically will carry them for a lot longer because they're in the cloud. They're cloud-based, so we don't necessarily need to delete them. Okay. And then each clinic will follow a POVMR, which is basically a problem-oriented veterinary medical record, or a POMR is also what they're called. And so we'll touch on that, but we're not going to delve into that in too much detail because we discussed the SOAP record, and that's really the main format that all clinics are going to use. And depending on, of course, the software, and if they're using paper records, it might appear different, but it's still the same general format and where information goes and belongs. Okay, so a medical record has to be created at the time of the first physical exam by a doctor. So the animal is not a patient of that doctor until they're examined by that patient, or I'm sorry, by that doctor. So the doctor has to examine that pet in order for them to be considered their patient. Okay, so a lot of clinics, what they'll do is they'll make the record sooner. So they'll open up a patient chart, they'll open up a client chart in order to schedule that appointment, but they're not considered a patient at that hospital or at that clinic until they are examined by a doctor. So medical records, like I said, there's a legal minimum. That minimum is 3 years. So a medical record has to be kept for at least 3 years past the last date of service. So say you have an animal come in for a spay procedure, 2 weeks later, they come back and they get those sutures removed. They will have to, the clinic has to keep those records 3 years past this date, past the date that the animal came in for the suture removal. Okay, again, most of the time they're going to keep it longer than that, but that's the legal minimum. Okay, so now we're going to talk about owner and client information. So the owner's information, or the client, those are kind of interchangeable terms that we can use. So for their first name, address, phone number, things like their employer, we don't necessarily need to know. In some cases, some places might keep that information, but in places that I've worked at, we don't ask their employer unless we might be opening up a line of credit for billing because they couldn't pay their bill in full that day, for example. We're going to get their spouse or basically alternative owners information. So, if they live with their parents and they want their parents to be a secondary owner on the account, we can add them. We want their email and, again, emergency contacts. So emails are very important. A lot of clinics will do our email marketing, but email reminders are the biggest thing. So owners can, in a lot of softwares, actually opt out of getting those email reminders or email ads and things like that. So sometimes all the owners will get are things that we manually send them. So things like an invoice or a document or their x-rays or things like that. Some people do like to get all that information though. So it's really just, it's personal preference, and you might just have to learn your software. Some places might keep credit card, social security, driver's license, but we don't often keep their credit card on file. We really only do that if it's a billing sort of situation. So if there's like a wellness plan situation, and we need to have their credit card on file for that. So, you know, I worked at a VCA and they do care clubs, or they do those monthly plans where they bill monthly. So we would need their credit card on file. Social security isn't really going to be kept. Driver's license numbers might be kept if, say, somebody's using care credit, in which we need to validate their ID, but in which case you should be looking at their ID every time they come in. So in my experience, there's not really an instance to keep their driver's license number on file. Some places might do that in terms of if they're dispensing controlled substances to that person, but it's not going to be super common. Okay, patient identifying information has to be stamped or labeled on every page of the medical record. So especially if it's a paper copy, right? We don't want papers to get lost or jumbled. So we are going to keep that information on every single paper. So that way we're not losing that information. So the identifying information is known as the signalment. So this term should look familiar to you because we use it in nursing. We use it in a lot of places, so like lab documents and things like that, but more specifically in nursing, because we're going through that right now. So this will have the patient's name, and remember their name is going to go in quotations because, you know, some names like human names can be used as pet names as well. So, you know, Bella is a fairly common animal name, can be used on people. Their species, so dog, cat, bird, lizard, bearded dragon, whatever it may be, we have to document that. Their breed. So again, if it's going to be more of an exotic pet, so like a lizard, then we're going to have to document specifically what kind, like if it's a leopard gecko or things like that. Their sex and reproductive status, so male, male neutered, female, female spayed. Okay, and it's spayed, it's not spaded. And then date of birth or age. So usually what I ask when people are giving me an age, or I usually at least confirm with them, you know, it's going to put the birthday as today 6 years ago, because you're telling me that they're about 6 years old. And usually just make sure that they're okay with that and that they understand that, because they might say like, oh, you know, he was actually born in October 6 years ago. So that might help lead a more accurate age. Okay, so consent authorization forms, these are very, 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 very important. You guys will spend a lot of your time going over these forms with owners and educating them on what they mean and what risks they're taking whenever they authorize certain procedures. So consent forms, again, very critical. They help protect the practice in case of litigation. So it's also an opportunity for you to educate the client on what's going on and the possible complications. So for example, we have estimates. So an estimate is a list of the items, the treatments, and the costs associated with those treatments for what we're going to be performing. So say we have an exam, which is $50. Say we have a rabies vaccine, which is $20. And say we have a nail trim, which is also $20. They're understanding each of those items and how the costs break down, rather than just seeing, okay, this is what we're doing. It's going to cost you $90. Okay. So we can really go into the details of certain things. So, you know, say we're giving a surgical estimate and it has hospitalization listed, it has IV fluids listed, it has the actual surgery operation, the medications in hospital, the medications to go home. Everything is going to be very detailed and itemized, not only for the owner to understand what's happening, but also for us to be able to know, you know, what are these funds going towards? Because say, you know, our surgery ends up going more easily than we thought, and we don't have to use cautery or something like that, then we can actually remove that cost and we can help alleviate some of that funds for the owner and make the medical record a little bit more accurate, rather than just saying, you know, surgery, such and such. Having a detailed itemized invoice is going to be more accurate for our medical record. And then our treatment plans themselves. So a lot of times treatment plans go hand in hand with estimates. So, you know, the cost of something and what we're planning to do kind of go hand in hand. anesthesia consent form. So it's going to be an individual consent form. So if an animal is going in for surgery, we have an estimate or a treatment form and an anesthesia form that they need to sign both and authorize and understand both of them. So the anesthesia record, we might be explaining to them on that, every animal has a risk when they're going under anesthesia. Their life is hanging in our hands. We are monitoring their anesthesia, their depth, but ultimately the anesthesia poses a health risk to a lot of animals. So, understanding or making them understand what that means for them. And a lot of times with those anesthesia records or consent forms and hospitalization consent forms, we're asking what we call a code status, or basically, are we a DNR or not? So if that animal were to go under cardiac arrest, either during, before, or after anesthesia, would that owner want us to perform CPR? So we need to ask that. And I usually explain to them what that entails. So CPR requires intubating if they're not already, right? If they're already in surgery, they're likely already going to be intubated. It's going to require chest compressions. It's going to require emergency medications to be given. It's going to require vitals to be monitored, things of that sort. And then I always remind them that, hey, the doctor's going to call you. So make sure that I have a good contact number, because if your animal goes under cardiac arrest in our care, we need to be able to contact you while that's happening so we can tell you what's going on and you can tell us how to proceed. And then euthanasia. So like all of these consent forms and treatment plans and everything should be signed before things happen. We want them to understand before we perform those treatments. Some of these treatments are irreversible, right? Euthanasia cannot be reversed. Once we put an animal to sleep, we cannot bring them back. That medication does not have a reversal. It does not allow for any recovery from that euthanasia process. So we need to make sure that they are fully understanding of what we are about to do, how much it costs, and what that means for them and their animal. So only the owner or an acting agent, so anybody on the chart, basically an authorized user, can sign a consent form, and they do have to be 18. I have had owners, send their 17-year-old son with the dog to the vet for the blood work profile, or even for something as simple as a nail trim. I'm sorry, you're not 18. You legally cannot sign this medical document or this legal document. That's my authorization form. Even if it is at no cost, you are not legally allowed to sign that document and authorize this treatment. So I cannot move forward with any treatment. And I have had to send people away because they were not 18. And I had to explain to their parents or their significant other on the phone that I'm sorry, even though I completely trust their judgment. And yes, I understand they turn 18 in the next couple of months. I can't have this happen. They can't sign my forms for me. So either you can come now or we can reschedule. And a lot of times we end up having to reschedule, unfortunately. So again, estimates, Arizona state law mandates that people are given that estimate of cost before treatments are performed. So estimates should be signed by that client just in case there's any dispute over payment. So that actually happens a little bit more often than you guys might anticipate, that an owner might sign authorizing for an $800 spay procedure, and then they come with $500 and they're like, well, I don't have the extra money right now. I didn't know it was going to be that much. Well, I'm sorry, sir, you did. You signed this form saying that you understood it could be up to $800 or something along those lines. So if an estimate is declined by an owner, the best thing that we have on an estimate is that there are two lines. So say, this line up here is saying, yes, I accept these charges, I approve this treatment, but you wouldn't want the decline to just be like a checkbox. You want them to sign on a completely different line. So that way there is absolutely no confusion. Again, remember, some of these times, these forms can get taken to the board, or people can sue over these things. So we want to make sure that we're being as accurate as feasibly possible. So we're often going to have them sign on a completely different line. Usually what I like to do if an owner declines parts of an estimate, maybe if it's only one part, I might just strike it through and have them put their initials for me, or have them, strike it through, put their initials. And then I might, put a new total, like calculate the new total without that item, and then initial next to that, and then document, owner declined the nail trim and anal gland expression, but approved the exam and vaccines. something along those lines. If they're, picking and choosing a lot of different things, what I might do is have them just decline the whole estimate and then go and make a whole new one and have them approve that one. So that way we're not having a lot of confusion, lines, cross outs, different things like that. But if they're just taking off one or two small items, then I don't see why we couldn't just have them initial verifying that, yes, I declined these services. And then we obviously are going to sign every single estimate and consent form, authorizing and verifying that we were the people that went over that form with them. So, if I have Mrs. Smith sign this estimate here, I am also going to sign it and say that I was the one that had her do it. So that way everybody knows if they have any questions, or if she has any questions like, oh, I wasn't explained what this is, then they can come to me and be like, Madison talked to you, or Maddie talked to you about this, and we know that she had gone over this. Do you have any questions that, we can address with her? Or, goodness forbid, if we get taken to the board, then I might get questioned or something like that. I have not been taken to the board, by the way. Treatment plans, again, will have a list of services that the doctor wants to carry out. They are often combined with that estimate to save paperwork and time. So the client has to sign and consent to the treatment, even if it's free. So even if we're just doing a suture removal and it's after the surgery, like 2 weeks after, they come in to get those sutures taken out, they have to sign authorizing that treatment. Even if it's free, they have to sign authorizing that we are allowed to do that procedure. Again, then they have to be 18 in order to sign that legal paperwork. So we shouldn't do any treatments without the consent of the owner. Now, the exception to that, of course, will be if it's a shelter animal, right? They have no owner. So that's going to be up to the doctor. They're going to basically step in as their guardian. So anesthesia, surgery, they have their own consent forms because of those potential risks, right? So that anesthesia consent form, like I said, is going to have that disclaimer. So it's going to go over risks and basically absolve the clinic of liability, because once they sign that paper, they're acknowledging that they've read and they understand those risks. So oftentimes what I like to do is to give the owner time with the consent forms in order to read them. And I do recommend that they read them. But then what I do is I go over and I bullet point all the main information. So, anesthesia, it poses a health risk to everybody that goes under. It's a very heavy burden for the cardiovascular and respiratory systems. It really works the liver and the kidneys. So, that's when, if we haven't done blood work already, I recommend it. So that way we can make sure that they're working properly. So we're not going to have any unknown complications during surgery, because if they choose to decline those, then, we don't know if the liver is going to be able to metabolize those drugs properly. We don't know if the kidney is going to be able to excrete them properly. What if they're in kidney failure? And we don't know. So that's why I recommend those as well. So again, Arizona state law will mandate that before an animal is euthanized, we have to have written authorization from a pet owner. Now, I'll say with things like COVID and clients being curbside or during emergency, sometimes that's in the form of a double verification with employees. So, say your doctor is on the phone with them and they're like, your pet's very critical. I don't think your pet's going to make it. Do we have permission to euthanize? That is my best recommendation. They get that verbal authorization, and then they might pass it to you and you'll be like, Mrs. Smith, I'm so sorry. I hear that you're going through a very rough situation with Duke. The doctor told me that your decision is to euthanize. Is that the decision that you would like to make? You understand that this is irreversible and that we are putting your patient to sleep, right? And then she would say yes, and you'd be like, okay, and you would do whatever needs to happen process-wise, maybe payment, maybe care of body discussion. And then I like to physically sign a piece of paper and have my doctor or whoever else verified sign a piece of paper saying, yes, I verified that this person knew what euthanasia is and that they were authorizing it for this patient, without being able to physically sign a piece of paper. Okay, and then we should have them do that before the euthanasia is performed. So again, they can make it very clear that it's a final decision. I did have an owner once come in to a euthanasia, and it was for his dog that had cancer. And he said, I completely understand what's going to happen. I usually ask during euthanasias, do you know what's going to happen during this procedure? And he said, yes. And so I said, okay, are you ready for me to place the catheter and then for the doctor to come in, or would you like some more time? And he said, nope, that's fine. But when am I going to get him back? And so I was like, what? And he said, well, you're going to perform the euthanasia, but when do I take him home? When will he be good to go? Sir, he won't be. Once we euthanize, he is being put to sleep and he won't come back awake. He won't come back alive. So the owner actually didn't know what euthanasia meant, and he ended up declining the euthanasia service that day. So again, that was I had him sign saying that he declined on the euthanasia consent form. He signed that he declined, and I documented our conversation, and he went about his way. On that euthanasia consent form, there will be a question asking if that animal has bit anyone within the last 10 days. That is because of rabies. Rabies is a reportable disease. So no matter who calls you, if it's PAC or Marana, like animal shelter, that they want that information about, did this animal bite someone? Were they vaccinated for rabies? Things like that. They get that information. But because it is so fatal and because it is zoonotic, it is very important that we have that information. Okay, so now we're going to briefly talk about certificates. So a certificate is a piece of paper or is a document that requires the signature of a doctor. So these 3 certificates are very important for you guys to know because you guys will be using them all the time. So we have vaccination certificates, and that can be just a plain old certificate listing all the vaccines, their due dates, and the doctors are going to sign saying that, yes, I gave this animal these vaccines, that is accurate. The spay neuter certificate is saying, okay, I just spayed this animal today. They are incapable of reproducing. Sign, verify. Health certificates are going to verify the animal to travel. Now, there's a couple different ways the animals can travel from health certificates. By car or by plane are the most popular. And that can be within America and outside of America. Of course, if they're going to fly, a lot of times they're going to fly within America, but they can fly to places like Singapore or overseas or to Mexico or fun stuff. If they're going to drive, that's when most of the time they're going to be still in America, but they can drive to like Canada, Mexico, places like that. People do that all the time. So health certificates, again, signify that yes, this animal is healthy enough to travel. This will require a physical exam and a doctor's signature. So if by car, within 30 days. So say they're taking a trip, like a road trip, they're going to be gone for like 2 weeks. That one health certificate is fine for the whole trip. Say they take a plane and they come back 2 weeks later, they're going to, wherever they are going, so say they're going to Illinois or Minnesota or wherever in Alabama, something like that, they need another health certificate from a doctor there in order to come back via plane because it has to be within 7 days. So sometimes that gets tricky when we're having them fly international. So say they're going somewhere like Singapore or even Hawaii, even though it's not international, they have a lot of requirements in order for animals to be able to fly in. That has to be done within 7 days. So we have to overnight ship it to the State Department, have them sign authorizing all the paperwork, and then it has to get overnighted back to us, and then the client has to pick it up. And that has to happen within 7 days of them leaving. Otherwise, they either don't take their pet or they have to reschedule their flight. Okay, so now we're going to touch on ownership. So that's medical record ownership. So who owns the medical record? The veterinary practice. Not the doctor, not the client, not the tech, the veterinary practice. The owner is legally entitled to get copies of that record within 10 days of their request. Oftentimes it's going to happen faster than that because we have amazing receptionists on our team. But the owner and anyone authorized on the account can request those records, but the patient's records cannot be released to anyone other than the owner without that owner's consent. So, say they're going to a new clinic, we have to have the owner's consent in order to send those. Yeah, so the owner can get those records. So we have to make sure that we are putting professional terminology, we are putting accurate terminology, and we're not putting like our feelings. So we're not going to put that, oh, the client offended me by saying such and such. Okay, we're going to be very objective in our documentation of conversations with owners. So, even if the owner is very upset, we might not document that they're upset. We might say owner began to raise their voice in exclaiming or in saying that they were not happy with our services. Whatever it may be, it has to be in a professional enough language for the owner to read it and for the law to read it. Okay. Where we can have exceptions to sending records, like I mentioned, reportable diseases. So if an animal is diagnosed with a reportable disease, then we don't need the owner's consent to release that information. So things like rabies, brucellosis, equine encephalitis, especially rabies, if so if they're going to, board their pet while they're going on vacation, and that boarding facility calls and they're like, hey, yo, when was the rabies vaccine given? You can say when that rabies vaccine was given and when it's due. That is a reportable disease. We are able to disclose that information without their consent. Now, remember, what are we always going to do when we have a conversation regarding that patient? We're going to document it. So we are going to open a note in the chart. And we're going to write in there that so-and-so from so-and-so called for this vaccine information. This is what I told them. Here's my name, initials, done. You've documented it. So that way, if it ever comes about that, the owner calls and they're like, hey, my animal wasn't accepted. They said you didn't share the vaccine information. Well, actually, ma'am, I talked to Chris about it and gave him all the information, but it's overdue, that kind of thing. Okay. The rabies vaccine, again, is not confidential, can be reported to anyone who inquires. So if that animal is involved in a bite case, the animal control, so like PAC in most cases for us here, is going to want a copy of their record, and they are entitled to that. Definitely. Another case where, if we are sending an animal or giving an information to animal control is if it's a stray animal. Or relinquished animal. Sometimes PAC will have the availability to pick up relinquished animals from a clinic if they relinquish the animal to the clinic, for example. Now, a lot of times nowadays, that's not super common. But, if an owner brings in like a stray animal and we call PAC and we're like, hey, can you come pick this thing up? And they're like, yeah, we're going to send a copy of the medical records with them because that animal right now, as of that moment, does not have an owner and there's no one to give consent. So in that case, again, that doctor is going to step in and be like, you should have these records because we cared for this animal while they were in our clinic. So requesting medical records, again, vet clinics have 10 days in order to give records to the owner. Whenever we give records to a new clinic, we are going to still keep their records on site for us. Okay. In some cases, management may need to approve the release of records, but a written release should be signed by the client whenever they are requesting records or having records sent somewhere. I'll tell you that doesn't always happen. Sometimes it's just verbal approval, or sometimes it's request from another clinic or something like that. And we'll typically just send over those records. Okay, so we're gonna talk about organization and filing. So again, remember, different clinics are gonna be paper versus computer, different softwares, but they'll have a chart for each each client, and then each patient will have their own section. So they're kept in reverse chronological order. So the things that happen first, so their puppy visits get put underneath the newer visits. So say we do puppy vaccines, it's going to be first vaccine, second vaccine, third vaccine, fourth vaccine, then the spay, and then all the rest of their life care, and then end of life services. Everything is going to be reverse chronological order. So you can see the most recent thing first. Some will have a cover sheet, so at a glance information. And again, some softwares will actually give you a summary of that patient on one sheet. And then in some clinics, each patient will have their own chart, but it's really most of the time, it's a client chart, and then each patient will have their own. So even our paper records on campus, it's each client, so each person, and then each patient has their own section. So I have one chart and my 3 dogs have a section within that. So here's that POMR again, or POVMR, okay, problem-oriented medical record or problem-oriented veterinary medical record. It's a requirement of AHA for a clinic to remain accredited. So their records have to be in this format, which the SOAP format falls within that. So it is an acceptable format for those records. And it's gonna be the most common thing that we see in veterinary medicine. So you won't necessarily have to worry about knowing the other ones as much. This is what we're gonna be using. So most charts are gonna be filed alphabetically by last name. Some will chart via numerical order by folder number, which is a problem, right? Like at one of my clinics, I was client number like 1,000 or like 18,810 or something like that. But my last name started with a V. And then there was a client with an A who was like client 23,000, right? That's going to be a problem because there's not an easy way to go and find them. You'd have to know their client number, and that's just not feasible whenever you hit thousands and thousands of clients. So computerized medical records, they might be what we call paper light rather than paperless. No clinics are going to be completely paperless. So they're going to use both paper and computer systems. Again, they're not really going completely paperless. They're going more paper light. So in order for those computerized systems to be successful, everybody should be trained in terms of entering all data. So that might be for you guys, entering records in the actual medical record or in the SOAP. That might be documenting client conversations. That might be learning how to scan things into the chart, because say we have a paper, that estimate consent form, okay, that has to get documented in the chart somehow. So we're typically going to scan it and then upload that PDF or that JPEG into the chart so it's visible. And that way we can get rid of that paper and shred it and use it for bedding or whatever. So a lot of the computer systems will have templates, and those templates are going to vary based off of the practice, the doctor, their preferences, tons of things, tons of templates, and you're really just going to have to learn based off of your clinic's protocols and templates and doctor preferences and all that fun stuff. Okay, ethics and legality. So Arizona law requires that a veterinarian shall maintain that medical record or that written record for 3 days after the last date of service. So that VCPR, see where that's coming up, that doesn't expire until after 3 years of no contact. So this includes things like x-rays, other diagnostics, medical records, conversations, all of that has to be kept for a minimum of 3 years. Now, that VCPR, so getting more into it, it's the veterinary client-patient relationship. I've also heard veterinarian client-patient relationship. While again, legally valid for 3 years, that number can change. So it's likely practically going to be 1 year. This is why we recommend annual exams. It's going to renew that VCPR. With that current relationship, the doctor is able to dispense prescription medications. So say we have an older animal who came in August, right? It's April right now. So, you know, say that owner calls, they're like, hey, my dog is pretty painful. Can I get a refill of the medication that I got a couple months ago? Of course, you were here within the last year. Your VCPR is still valid. I've got refills on that prescription. You can pick it up tomorrow. We could administer vaccines. That policy might be different depending on your clinic. So I had one clinic where we were techs were able to administer vaccines except for rabies. That has to be given by a doctor. We were able to administer vaccines within 6 months of a current exam. I also had one clinic who allowed all that, or required that all vaccines except for Bordetella or kennel cough be administered by a doctor within that year. So, you know, even if it was 9 months later, we could administer that kennel cough vaccine, but all others had to have a doctor exam. So you're just going to have to know what your clinic's protocol is. Again, rabies is the only one that's legally required to be given by a doctor. We can sometimes perform repeat or recheck diagnostics. So say they come in and they are on thyroid medication or something for valley fever. We can have them come in for a technician appointment, pull that blood or get that sample, send that out to the lab and have that doctor interpret or analyze those results, even if they haven't been for a doctor exam in a couple of months. So say we're just rechecking that disease. And they can also answer questions. So, you know, based off of the patient's health, where it was, we can see in that physical exam, remember in that objective section, we're going to have those physical exam notes. We can see where that patient was. So, you know, we might be able to ask questions to the owner and help answer their questions based off of what kind of concerns they have going on. Sometimes that does mean, you know, we do recommend bringing your pet in for another exam so we can evaluate what that concern is. And sometimes it's just, yep, this is a normal part of whatever disease process is going on. Continue what you're doing, or why don't we change plans up a little bit, things like that. So as long as we have that current VCPR, which is likely going to be within that 1 year time frame. Okay, I will say there are some circumstances. So say you have like, you know, a 19-year-old toy poodle, right? They are past their life expectancy, well past their life expectancy. So that window might be a little bit shorter. That doctor will probably want to see that patient every 6 months, if not every 3 months, because the older they get, the more rapidly their health can deteriorate and things can change. So, if you saw that toy poodle as an 18-year-old, things are probably going to be a little bit different now that they're 19 years old. So they're probably going to want another exam, blood work before they prescribe any medications. Okay, so, and then again, by law, lots of legalities here that we have to follow. Radiographs have to be imprinted with the following. We take digital x-rays about 98% of the time. So it's going to, as long as you put all of this in the software, it's going to automatically imprint onto your x-ray. So the owner's name, animal name, the date, the name of the doctor, the practice, the information for the practice, and then the orientation. So, in your software, you're going to enter all your owner patient information, your doctor, what images you're going to do. And then you're going to take those images and all this information is going to go on there. So you have to make sure that this information is correct because it is going to imprint onto that x-ray and it's going to be forever part of that image. We cannot alter that information once that x-ray has been taken and finalized. Okay. Here's more legal requirements. So do we have HIPAA? HIPAA is a human thing. So, but client information is private, so it cannot be shared with anyone outside the practice or an employee. We cannot share it with another client. We cannot share it with our friend. We cannot share it with our neighbor. So computer records should be password protected. Even if your monitor is visible to your client, I would not access records of other patients or other clients. So, you can pull up your client's record and you can show them their own documents. You can document things while you're there, edit your SOAP notes, things like that in there, but you should be logging out of it or locking the computer whenever you are leaving the room or not going to be in direct access to it. That's very, very important because you will have some clients that get nosy in there. So charts and folders have to be kept out of reach. If there's any paper records, they have to be, kept private. So whenever we have paper records with owner's information, if we are done with it, so say we've scanned it in the chart and we no longer need it, we're going to put it in the shredder or send it out to be shred or, put it in the pile of shredding to do. And whenever there's a dull moment, you can go ahead and shred it all, but we're never going to throw that information away because it is protected information. So HIPAA is Health Insurance Portability and Accountability Act. This is human medicine only, so it does not apply to veterinary medicine, but we are still legally required to keep their information protected. Okay, remember the exception are going to be reportable diseases, so rabies, brucellosis, equine encephalitis. Okay, now we're going to hit record logs. We're almost done with this first part. So a log is a continuously running record of important events. So it's not part of their medical record, but it's still a legal document, so we still want to keep it. So some logs are required by law. Some logs are just more convenience to the clinic, and they're kept just so we know what happened when, by who. So we have anesthesia logs. Those are legally required. Controlled substances logs. Those are legally required. Radiology logs. Those are legally required. Laboratory logs, however, are not. They're just to make sure we know what got sent out when, by who. So, if we 2 weeks later don't have the results for a fecal analysis, that's suspicious because fecal analysis only take about a day or two. Okay, so by law, any animal that has been rendered unconscious after having undergone induction and inhalation of an anesthetic has to be recorded. And that specific inhalation anesthetic, because sedation does not necessarily have to be recorded in the anesthesia log. Now, again, it might depend on your clinic. I had one clinic where all sedations and anesthesias got recorded in the anesthesia log, just to, as much as a CYA as possible. So state requires that by law, the anesthesia record has to have the date, animal name and species, owner last name, so animal first and last name, basically, how they recovered. So did they recover uneventful? Were they euthanized? Did they recover dysphoric? Like, were they all crazy? And then the name of the doctor administering the anesthesia. So the law will also require that the heart rate and respiratory rate of that patient be taken at the time of induction. So we are inducing that animal, vitals need to be taken. And then every 15 minutes thereafter. Now, golden standard. So for those of you that have been through surgery are like, that's not what we do. No, AHA standards and what we hold ourselves to is to record vitals every 5 minutes. And we're going to record more vitals than just the temperature, heart rate, respiratory rate. We're going to record things like blood pressure, oxygen saturation, the ECG. We're going to mark that. We're going to mark the carbon dioxide output, the anesthetic depth, the capillary refill time, the mucous membranes. There's a lot of vitals that we're monitoring under anesthesia because their life is on the line and it's in our hands. So we need to make sure we are assessing everything so we know how our patient is doing under anesthesia. Okay, so and then controlled substance logs are drugs that have a history of being abused. So if they are a scheduled drug, so schedules are what we use to classify how likely that drug is to be abused by people if used. We have to heavily document where every part of that drug goes. So say we purchase 10 milliliters of a drug, we use, I don't know, 1.8 mils for one patient, 2 mils for another, and somehow there's only 2 mils in that bottle, something went wrong. So, you know, whether we didn't, like, part of a drug didn't get documented or some of it got used and wasted or something like that, but something went wrong. So we have to explore what happened and where that drug went. It is very regulated. So the controlled substance logbook has to contain the name of the doctor, who handled the drug, what the drug is. So form, strength, bottle size, you know, say we're doing like phenobarbital 50 milligram and there's 1,000 in there and we only need 2. We have to document all that. Patient and owner name, the date used or dispensed. So used can be for an in-hospital patient. Dispense would obviously be dispensing it to an owner, and the amount used and then the amount remaining. So say we have that 1,000 pill bottle and we only pull 2, we have 998 left. Now, the reason for that, and we're going to do that the entire time, is at the end, say it says that we are supposed to have 10 pills left and the bottle is completely empty. That means somewhere in all of that documenting, something went wrong. Somebody did math wrong. Somebody didn't document correctly. Somebody didn't count correctly. And we have 10 pills that are unaccounted for. And so that needs to be audited. So every accounting of that drug being used or dispensed has to be evaluated. Now, we're not going to dispense these controlled substances until the owner is actually physically in the building. Okay, so the controlled substance logs have to be in bound books with numbered pages. Again, every clinic's going to have a little bit documented, like different of a documenting system. The DEA actually has books that can be purchased. They're just quite expensive. For what would be about the size of a composition book might be about $80. So some clinics might make their own, but they have to be legally upholding the DEA standards. Okay, these have to be kept on practice or on premises for at least 2 years. Again, oftentimes they're going to keep them for longer because, you know, say we have a patient that went under anesthesia 2.5 years ago, we still kept the patient's records, right? But we probably want to refer to the controlled substances logs as well. Okay, and then we have radiology logs that are going to be basically lists of what we did, when we did it, who we did it to, who we did it with. So it's going to have the patient, remember, patient name and owner name, owner last name, the date, the position, the views, and the technique used. So all the settings that we used on the x-ray machine are going to be logged and written down, along with who was there. So who actually took those x-rays. Laboratory logs are going to be what test performed where. Okay, so, you know, did we send it out? What blood tubes did we send? What samples did we send? What tests were we sending them out for? Things like that. And then we also have euthanasia or cremation logs. So, you know, we have a patient that we put into the freezer to send out for cremation. What type of cremation are they going for? What doctor was it? How many clay paw prints did they want? Things like that. Medical waste potentially, and then inventory. Again, every clinic is going to do these a little bit differently. So you'll just have to learn what your clinic's protocols are. Okay, last on this section, I told you we were almost done. So we have the DEA, which is that Drug Enforcement Administration. So that's the federal agency that regulates the distribution of controlled substances. Not all doctors have a DEA license. So only one DEA is needed per clinic. And that's going to be the head doctor. So all controlled substances within that clinic are under that one license. So on our campus, we have 2 doctors, and our primary doctor, our full-time doctor, she is the one with the DA license here. Okay. We are only going to use schedules 2 through 5 in clinic. Schedule 1 needs special licensing, is mainly for research purposes. Schedule 1 are more likely to be abused than others. So like heroin, ecstasy, LSD, whereas 2 through 5 might be like morphine derivatives, butorphanol, euthisol, things like that aren't as likely to be abused. Then we have the Veterinary Practice Act, which is the act that is held in place by the AVMA, or American Veterinary Medical Association. It is a set of guiding principles for the veterinary field and the people that work within it. So state-wise, so within the state, this act will define who can and cannot perform certain tasks. So in like California, RVTs, or registered veterinary technicians, can extract teeth. Here in Arizona, CVTs cannot. The DVMs are the only ones to perform surgery. For example, remember there are 4 things that doctors are the only ones able to do. So surgery is one of them: prescribe, diagnose, and prognose. So actually cut the patient, send home medications, or tell them what to give, tell them what's wrong with their pet. So give a diagnosis and then give a prognosis. So what's the likely outcome of this patient given the current ailment and their current condition. This will not restrict doctors on like what they can see. So, it's not going to say like, oh, you're a companion animal clinic, you can only see the dogs and cats. It's not going to restrict them on that. Okay, that's important to know. Then we have the AZVMEB. So for those of you wanting to be a CVT, this is going to be important. So it's the Arizona State Veterinary Medical Examining Board. This will maintain licensure and credentials in the state of Arizona for doctors and CVTs. So, if say you became credentialed in another state, or say, you were just wanting to be credentialed in the state to begin with, you have to take a state test along with any national requirements. So we have a VTNE, which is a veterinary technician national exam. So a CVT, to retain their license or to keep their license, we have to be working in the field. Okay. We have to get 10 CE or continuing education credits every 2 years. So CE means continuing education. That can be acquired from conferences. That can be acquired from online. So there's a ton of different websites we can get CEs from. That can be from different presentations. So VSCOT on River and I want to say La Cañada. They are a specialty center and they often hold like meetings and teaching, so that way they can issue CEs. And then we have to complete a form and pay $100 at the end of each even year. So right now it's 2022. That means at the end of the year, I have to complete a form, send in a list of the CE credits that I've obtained, and send in $100 in order to stay a CVT. Doctors will have more CEs required. They have 20. They have a higher fee. I don't remember exactly what that is, but they also, if they have that DEA license, they have to have additional CEs in order to maintain that DEA license, specific to opioids, given the opioid crisis we're going through. Okay, so I'm going to take a brief moment while we prepare to talk about success in the vet field. Okay, so now we're going to talk about success in the vet field. So we're going to discuss the potential impact of social media on the practice and the employees, and then desirable qualifications and attributes. And there's some other information I'm going to go over that's not quite in your objectives that I feel like is good information for you guys going out into the field, that I want you guys to know in order to be successful, and what I've seen go wrong. So we're going to talk about seeking employment, being professional, interacting with coworkers, which is a huge thing, and then qualities of a good VA. And again, we're going to talk about these in class as well, but I want to set you guys up for as much success as I possibly can. The more time I spend on this lecture, the more I feel like you guys are successful out in the field. I've had a lot of my externs, a lot of my students get hired at their extern site, because they are showing desirable attributes. They are being professional, they are being kind, they're being open to learn. So as much as you guys know here and learn here and execute on your externship, the willingness to learn and to continue to grow as a VA is really going to help cement you guys in getting jobs and being successful out there. Okay. So seeking employment, so deciding where you want to work. You guys might have an idea now, but you might change your mind. I really wanted to work internal medicine. And then I found out that I really did not. I actually really like emergency and dermatology. I thought I was going to hate skin. I was like, things are gross. Skin is going to be dry, flaky, crusty, itchy. It's just going to be really disgusting. I found out I actually really had an interest for it because I worked with a doctor that was really good at it. And we like what we're good at. So I started liking working with skin. Searching for job openings, former classmates, so alumni is one of the biggest reasons I found multiple of my jobs, or not even just former alumni, but former coworkers. So like I worked at one clinic, and then I had one of my coworkers leave to manage another clinic, and she created a job opening for me so I could go work with her again, for example. And then I left one clinic to go to another clinic, and I had about 3 people follow me to that new clinic. So it was pretty cool. So you can always apply, turn in a resume, even if that clinic isn't hiring. Again, I did that to one clinic and they made a part-time position for me. So choosing a place of employment, we're going to research each business before we apply. So what type of practice is it? What species do they see? How many doctors they have is pretty important because it's going to determine maybe how busy you are. So I worked at a clinic with 1 doctor and it was pretty slow. I worked at a clinic with 20 doctors and it was pretty dang busy. So just figuring out what you want. What are their days and hours of operation? And then there's a lot of things that you might contribute to finding a place of employment. So if your friend works there, things like that. Just consider all the possibilities, the pros and cons of why you might be choosing a place to work at. Okay. Remember, you can apply, interview, and even be offered a job, but not take it. So you can always kind of try it out, see if that's something that you want to be, or somewhere that you want to be. Interview them as well. Remember, when you go to an interview, you're not just getting questioned, but you're making sure it's a good business relationship. But relationships go 2 ways. So you should always have a resume along with your job application. And so we have career services to help with that. I am not the best person to help with your resumes, but I can definitely help you figure out what skills you want to list on there. I'm just not good at making them pretty. But definitely making sure that they are appropriate. They're going to be accurate because they're assessing your professionalism and your ability to complete a document. So just like that would transfer over to you completing a medical document correctly. So professional dress is always a must. You can dress business casual, or what I typically do is I go in scrubs, because what has actually happened a couple times is I've dropped off a resume, I've talked to a manager, and they're like, hey, do you have time to do a working interview right now? And so I'll just get thrown in the back, thrown with a supervisor or someone, and kind of just shadow them, work with them, show them my skills, and go from there. Sometimes they have 10 minutes to sit down and do an interview with you. So always just be ready. Always have what you need. Even if you don't show up in scrubs, have them in your car, because I've also done that. And they're like, hey, can you do a work interview? I'm like, yes, yeah, I can actually do one now. I have my scrubs in my car. And then she was like, actually, I don't have the time, but we can schedule for next week. So you don't always have to have a cover letter. In fact, in the veterinary field, not a lot of people do, but that's something that you can do. If you do have gaps in your employment, especially because, you stopped working to come to school or something like that, then just make sure that you're ready to talk about it. Okay, for your job interview, you want to arrive early. So 10 minutes early is standard. Not only so that way you can, make sure you're getting there on time in case of traffic, but they might also have you sign like a job interview waiver, if you're going to do a working interview. Dress professionally. So we're going to talk about some do's and don'ts. And then even if you gave them a copy of your resume, have a nice copy with you. So there's like some resume paper out there that's like $8 or $10 for like 100 pages. That's going to last you for years. I actually still have mine that I bought when I was graduating from high school, which is about a decade ago. Whew, it's about a decade ago, and I still have it. So commit that money. Be prepared to answer certain questions. So what experience, strengths and weaknesses, why do you want to work here? And it can't just be that I like dogs and I hate people. Absolutely cannot. So do you have an interest in medicine? Do you have an interest in a certain aspect of veterinary medicine? Something like that. And then why do you want to work there specifically? So showing them that you did research and that you know the doctor, or you know the species, or something like that. Why do you want to work there specifically? And then what are your short and long-term goals? So what I recommend is for your long-term goal. I don't care what your short-term goal is. Maybe you're just trying to gain expertise and gain experience. My long-term goal is always what quality I want and to be that point of reference for that quality. So at the last clinic that I got a job at, I told them that my long-term goal was to be a point of reference and a go-to technician for, and I gave them a short list of skills. So I wanted to be, the go-to person for things like emergency skills. So like placing an IV catheter and venipuncture and doing some of these other things. I wanted to be the point person for these. And I also wanted to be the leader in training because that's what I was really interested in at the time. So I would pick what you guys want to be the point person for and have that be your long-term goal. Again, it can change. They really just want to know that you are thinking about your future and that future looks like veterinary medicine, potentially at their clinic. Okay, so remember you are interviewing them as well. So, is this the kind of culture that you want to work with? So one of the things that I've seen online and that a lot of people have asked is, what kind of career advancements are there like for somebody in this position? Or you guys are going to go into a position where there's a lot of people in that position, but if you're ever interviewing for a supervisor position or for one specific task or area, then you probably want to ask them something along the lines of, the person that was previously in this position, how long were they there? And what kind of expectations did you have of them, or something like that. So that way you know what role you're getting into and what's going to be asked of you. Sometimes I'll ask you to pull from past experiences. Answer truthfully. They know if you're lying, they can tell. But it helps them assess that if you have good qualities and you can respond well to situations, to tough situations. So again, working interview, you want to be prepared. So you're wearing proper attire, you're bringing supplies, so you're dressing appropriately, and you're being professional. Okay, so we're going to talk about appearance first. So hygiene, don't stink. Okay, imagine if it takes 3 people to hold a husky down to do a nail trim, that's 3 people within a very small amount of space. So if you stink, everyone's going to know. So you don't want to have perfume on, you don't want to have cigarette smoke on, things like that. Clients, patients, coworkers, they can all know. They'll all know. Okay, and it's also going to put off a bad image if you're not keeping yourself up to date on hygiene. So scrubs should be clean. Again, no crack front or back means no boobies, no butts, none of that. For scrubs, I do recommend keeping a backup pair in your car so that way you have a pair to go to in case you get peed or pooped on or blood or anal glands or all that fun stuff. Hair will need to be pulled back. I'm sorry, I didn't think this was cut off, but we want well-groomed facial hair. So preferably like well trimmed and shorter, so that way it's not getting in the face of patients and clients and things like that. For jewelry or bling, it can be a hazard to patients. It can be a hazard to you. So, even hoop earrings can get caught on a patient's tooth, especially that puppy that's trying to eat your ear because yours taste yummy. So keep them to a minimum. All I wear are my rings. I don't wear jewelry or anything else. Makeup, keep it simple, keep it professional. Nails, clean, short, either no or neutral polish, but something that's not going to chip off near your patient. If you have nail polish that's starting to chip, get it taken care of. It looks really unprofessional. Tattoos and piercings, on campus, we don't care if it's as long as it's not offensive. And I'll tell you, a lot of clinics don't either. Some clients can get offended, but you also don't want to have like face and neck tattoos. Okay, we want to make sure that we're staying as professional as possible, but people expect tattoos nowadays. They're not as taboo as they used to be. Always make sure that you are acting like you want to be at work. So having good manners, decreasing conflict with coworkers, just being someone that you would want to work with overall. So arriving early to your shift. And when I worked emergency, to like get to the room to clock in, the break room, you'd have to pass through the treatment area. And so I'd usually like come in a little bit early. I'd walk through, I'd see how crazy busy they were. If they were stupid crazy busy, I'd immediately put my stuff down, clock in and get to work. If they weren't super busy and they could not have help for a couple more minutes, I'd just go upstairs and like chill out on my phone or eat a small snack before I head down. If you have time to lean, you have time to clean, which is not an understatement. You should always be staying busy. If you are just standing around, especially like on your phone, if you see someone else doing it, that's one thing. That doesn't give you the permission to slack off. So, on your externship, if you see someone on their phone, remember that they're an employee. You as an extern are basically in a 240-hour working interview to see if they want to hire you or not. So also make sure your coworkers know where you are. Say, especially you as a VA, you're going to be helping a lot. So you're going to be helping a lot of different people all the time. Say they need help, with restraint for a patient while they get blood and they look for you and they can't find you because you're in the bathroom or you're getting a bite to eat or something. If you're going to head off the floor, just make sure at least somebody knows. Okay. And then don't leave work until the work is done. So, again, on your externship, you're probably going to be assigned to somebody to help and hang out with. So just make sure that they're cool when you leave. Whenever, even as working as like a treatment tech or a room tech, I always just check in with a bunch of people and say, hey, do you need anything before I leave? Sorry. Or what do you need before I leave? So that way I make sure that everybody can leave on time and I'm not leaving, on time or a little early. And then somebody has to stay like an hour late to finish something. Whereas we both could have stayed a little bit late and then finished it. Cell phones should never be on your person. I'll tell you, some clinics, they allow phones on your person because they might have like an app that allows you to access their software. So you can like input a patient picture from your phone or call a client from the phone, even though it doesn't look like your phone number. But on your externship, it should 100% never be on you. It should be in your bag in your designated spot, and it should be off or on silent because nobody wants to hear your baby got back ringtone from the locker room and not be able to turn it off. I've had that happen and it's annoying. Okay, social media. So we're going to talk about this briefly, but the biggest thing is make sure it's professional. Make sure even your personal is professional. You can hurt your hospital's business or be fired for posting something on social media. So I had a coworker who posted on Snapchat that she was out drinking one night. And then the next day she called out sick. Right? We all know it's a hangover. She actually was the person to get the policy put in place that if you call out sick after you post on social media that you were out drinking, it was an unexcused absence unless you could provide a doctor's note. So make sure you are watching what you post on social media, who you have on social media, even if you love your boss, maybe you don't want them on social media. Okay. Even if you love your coworkers, you wouldn't mind hanging out with them. Maybe you don't want them on social media. Maybe you don't want people seeing that you went on vacation and or took some time off and just hung out at home, right? Maybe they'll try to call you in or something. Maybe you don't want that. I'm not the one to say that, but just make sure that everything is professional. You also don't want to post pictures of patients or any patient-related information without owner approval. And if you're doing that on your private social media, oftentimes people aren't getting approval from owners. And it's not just verbal approval, it has to be written consent that you have permission to post their patient or their pet on social media. So it's a very slippery slope, just posting things on private social medias. Okay, so I would never friend a client on Facebook or any social media. The only exception to that is when I was leaving that clinic and I was no longer going to have a professional relationship with them. And I only added the best of best clients. So I only have 3 friends on Facebook that are previous clients of mine. It can be very risky because you don't know if they're going to look through your entire profile and see that like weird bikini pictures, I don't know, whatever it might be. So you just want to make sure it's squeaky clean. Personally on my social media, I only post like major life updates and cute, funny pictures. My social media is boring. Make sure you have appropriate email addresses. Career Services has personally told me of multiple very funny, very non-professional emails. I have seen 420 in a couple of emails. I have seen 69 in a couple of emails, and you just don't want that. You just don't want that. Nobody is going to hire an email address that looks like that. Okay. Okay, interacting with coworkers. So the golden rule, right? We're gonna talk about being a team player and then dealing with conflict. So the golden rule, remember, is actually treat others how you want to be treated, but we want to be polite to everyone. So we're gonna greet everyone with a smile. We're gonna say please, thank you. Gossip. Gossip can get people in trouble very quickly and very easily. So if somebody is gossiping about somebody else, especially in clinic, one, there's like a 50% chance that a client is listening to you and can hear you, even if you're in the treatment area. The walls are not soundproof. But also maybe another coworker is hearing you and maybe they're misinterpreting that. Okay. I'll tell you guys, one of the reasons I got in trouble at my last clinic, it was just like a verbal warning, like, hey, watch what you're saying. I was talking about how I was going to come teach at PMI. I started off as lab assistant, so I was starting to teach VAs and help VAs in labs. And somebody heard that I was going to teach vet assistants, and they misconstrued it as that I thought that VAs didn't know what they were doing and couldn't do their jobs, which is absolutely not true. Some of the VAs that I've worked with are very skilled, talented people, and that I would still go to for help if I needed help. Some have worked with exotics more than I have. Some have worked in an emergency more than I have, placing central lines and all that nitty gritty, difficult stuff, high risk stuff that I haven't necessarily had a ton of experience with. I would 100% go to them for help, but somebody had misunderstood that. And so I explained that to my supervisor, what I had actually said, what the whole conversation was, but because somebody heard part of that conversation, they took it out of hand, out of context, and went and complained to my supervisor. And it was just a weird situation. So you are at work to do your job, not to make friends. That's the ultimate truth. And I'm sorry to put it that way, but you are at work to do your work, not to make friends. Nobody's paying you to make friends. Okay. So the other thing is, again, not participating in gossip, not taking sides. So if you need help, if you're having conflict, you speak with your supervisor. Okay. So being a team player, offer help. Don't over offer help. Again, some people can take it as offense of you don't think they know how to do their job. So, offer help, but don't just try to jump in and force help if they don't, obviously need it. So say they're dealing with a gigantic dog and they're trying to put them on the table and they're struggling. Yeah, probably go in and hold a butt for them and pick up that dog with them. Don't criticize though, compliment. So one of the biggest things I always said in clinics, and it was kind of like I had two go-to sayings: you betcha. So somebody would ask me for help, I'd be like, you betcha. That was my thing. And then I appreciate you. So I wouldn't ever just say thank you. Thank you to me is too colloquial. It's very common. So I like to say I appreciate you. I also, whenever somebody goes out of their way to help me, I like to go out of my way to tell them thank you and that I appreciate them. So oftentimes I was giving compliments to my supervisor about certain people to make sure that they knew, my supervisors knew that somebody went above and beyond to help, or, they did their job really well. Because, we're a team. We want to help each other and we want to acknowledge when people are doing well and being successful. We just want to, be the coworker that you want to have. So if I did a really good job and somebody really appreciated that, I would want somebody to go tell my supervisor that I did a good job, right? So I'm going to do that for them too. If you happen to have conflict with a coworker, it is inevitable. You will have people that you don't get along with. There's a lot of type A or strong personalities in the vet field. So do not take offense if somebody says something and you're like, man, I think that might have been offensive. Just try to think about it from their perspective before you, take offense to that, and think about what kind of intentions they might have had. Well, a lot of times they're not meaning offense. They're just, coming off strong because they've built an iron wall around their heart to last in the veterinary field. But what you should do is talk to them. Okay. Also, you can't hold people to your expectations. So like my expectations of myself is to always show up early, to stay late if necessary. And you can't always hold people to stay late. So what if they have to go pick up their kid from daycare? And if they don't pick up their kid for every 15 minutes late, they're charged $15. That's a pretty penny if you're an hour late. So some people physically cannot stay late. So you can't hold people to your expectations of yourself. Okay. So you can talk to them, be sincere, apologize. I have apologized for situations that I didn't feel like I was in the wrong, but they felt I was in the wrong. So it didn't matter what I thought, it matters what they think. And I want to keep a positive work environment. Remember, I'm not there to make friends. I make friends a lot of the time, but I'm not there to make friends. That's not my purpose. My purpose is to care for my patients and to do my job. So in order to do that effectively, I need to have good relationship with my coworkers. So sometimes I'm going to apologize for something they feel like I did wrong. Okay. Ask them what you can do to improve. So say they're like, hey, this didn't go super smoothly. Okay, no, thank you for your feedback. What can we do in the future? What can I do in the future to make sure that doesn't happen again? Always remain polite. Sometimes the whole ignorance is bliss. Even if you don't feel like you're ignorant, sometimes just feign it. Be like, what can I do? Or what did I do wrong? And then if it's not getting resolved with that individual person, of course, you can always seek supervisor help. Or if you don't feel comfortable going to that person, seek supervisor help. There is no shame. Even for you guys in my classroom, if you are having an issue with another student, please always feel free to come to me with that kind of situation. I want you guys to have a good, thorough education. And in order to do that, I want to make sure that there's no hostility and there's no tenseness between anybody in my classroom. I can't always see that. I don't always know that. So sometimes you do need to bring it up to my attention if that's not something that you can work out between yourselves, and I'll help with that. And if I can't help, I'll get someone that can. Okay, we're going to sum up with some 7 qualities of a good VA. So good animal communicator. So being able to read their behavior, and we're going to talk about, handling restraint, what we can see in behavior, what we can do to help with. For your guys' VA extern, your assignment is to do module 1 of fear-free certification training. You do put that on your resume. Please do put that on your resume. In vet tech extern, you do module 2. We want to anticipate their actions. They're our patients. We want to know what they're thinking as much as possible. Okay, so like this husky right here, terrified, absolutely terrified. This cat right here is on the offensive. If you try to go pick him up, he's gonna watch you. Whack attack. Okay, physical stamina. So you guys are gonna constantly be on your feet. It says get a Fitbit. You'll be surprised. You will be. In general practice, I probably averaged around 14 to 18,000 steps. In emergency, probably around 24 to 28,000 steps a day. Being able to lift and carry animals. So OSHA standard, remember, is up to 50 pounds. You should be able to carry above 50 pounds. You need help. I personally have lifted more than 50 pounds by myself, but make sure you're doing it properly. So know how to properly lift and be able to lift. Okay. You might be in awkward or uncomfortable positions as you're restraining animals for a long period of time. So I've held like a 60-pound dog on the ground in an awkward position for 45 minutes before. It is what it is. It was actually almost exactly like this. And I was like that for 45 minutes. Okay. Don't fart on your coworkers. Right. Good hygiene. Possess emotional resilience. So being able to handle difficult, stressful situations. So euthanasias are hard. They pull at our heartstrings a lot. My very first euthanasia looked exactly like a dog that I had just lost a couple weeks prior. So yeah, I cried. Yeah, the male doctor was like, what can I do? Are you okay? And I'm like, I'm fine. You can just go away. I'm just going to stand here and cry for a second. Sometimes I like to call them moments of weakness. If you have a tough case and you just need to like sit there and cry and eat chocolate for a second, that's what managers are for. That's what managers' offices are for. That's why they have a door that can shut. I have done that. I've gone to my manager and I said, I just had a really tough case and I need a moment. And they typically like offer you food or something like that. And they're just like, can I do anything? You're like, nope, I just need a quiet moment. And then they give that to you. Your managers are very understanding. They want you to be happy and they want you to last in this field. So if that means providing you with chocolate, they're going to provide you with chocolate. Having a sense of humor. We are very morbid in this field. Not all of us, but there might be some jokes thrown about, and I don't want you guys to get offended. They are just very common jokes, but like TTJ stands for transfer to Jesus. Okay. Pink juice is going to be like euthanol. So, I've heard a joke thrown around that, oh, that animal needs some pink juice. And that means that they're in a dire situation and they should be euthanized. But rather than saying that grimly, it's just our joke in terms of handling that. Again, if somebody's saying a joke, especially if they're not saying it directly to you, they're probably not meaning ill intentions. They're probably not meaning to insult you. So try not to take it as an insult if it's not overtly seeming like an insult, which really nobody's going to try to insult each other in this field. We're all just trying to get by. Fun jokes. I have the results for your stool sample. Delicious. Okay, so know how to interface with everyone. So being able to interface with clients, difficult clients, happy clients, colleagues, other types of personalities. I am often a different, like slightly different person when it comes to different people. Not that I'm two-faced, but I know how to accommodate what people need. So, you know, in my family, for example, I talk very basically, so I don't use any medical terminology with them. I know to explain things. So if I say something that, you know, you guys might know because you're getting this education, I know to explain it with them. With clients, don't use medical terminology. Or if you do, make sure that you explain it. So, you know, if you mention, you know, that heartworm is or mosquitoes are a host for heartworm, maybe then explain that, you know, they're the insect that's going to carry that parasite or that worm. Okay. So just make sure that you're able to interface with everybody. Okay, so things like what role do you play? I'm not expecting you guys to announce where you fall within this spectrum, but just knowing who you are and, you know, how you might be able to better accommodate working with certain people. Have a willingness to be present. So come to your job on time, be there, enjoy the work. No, don't complain about being at work. Of course, there are some things that we're going to complain about. If you get peed on, of course you're going to complain about that because that's disgusting, but you're not going to complain about hating your job, right? And then want to be more and do more. So we talk about continuing education being required for CVTs and doctors. A lot of times clinics will require their VAs as well to get CEs and to continue their education so they can learn more, keep up to date, learn as medicine changes, as techniques develop, things like that. So here are some resources in order to get that continuing education. And of course, career services will help you with certification requirements if you do choose to move on and be a CVT. And then, you know, being a veterinary assistant is amazing work. So I really appreciate the fact that you guys are here getting your education for it. See you in class.